Hello, everyone.
Good afternoon, everybody.
We've been at the International Plant-Based Nutrition Healthcare Conference in California, and we thought we would just present to you a few of our thoughts, highlights from the first couple of days from the conference. In the past, we've actually attended most of these, Malcolm, almost all of them. Since the first one in 2013, and we find it well worthwhile, the long flight across the Pacific, just to be in the room with hundreds and hundreds of other people who are all looking at this, who have seen the benefits of a whole food plant-based diet and how interested and inspired to do what they can in their community to advocate for this way of eating and including lifestyle. I think it's increasingly, even in the nutrition space, we're all acknowledging the importance of the other domains of lifestyle, so they've been touched on as well. We we've always in the past sort of, we've tried to read posts when we've been at this conference, and we're always under pressure and we're sitting up late at night trying to write something. And we thought, hey, let's just
Let's
it's
just
just
start
creating a video to chat about rather than having to put fingers to a keyboard and type it up. So here we are. And I might let you, Malcolm, lead off with your highlights.
Okay. Well, my highlights began with the optional workshop on the first morning with Dr. Scott Stoll, a full morning workshop addressing the question of what is the healthiest diet. Let's take a look at the science of keto diets, low carb diets, carnivore diets, and this is really interesting. Dr. Stoll had obviously done a lot of research and work in developing this presentation and was unbiased in the first bit of the presentation was actually looking at the many publications about the apparent benefits of a low-carb diet. As you're wondering about a carnivore diet, there's almost no science on that at all. But quite a lot of research done on low carb diets, usually higher in meat, but low carb diets. And, it's interesting that these studies often show some benefits, particularly in the area of weight loss. And when you stress the body, and restrict carbohydrates or even restrict food in general, and go into a state of ketosis. I mean, our natural ketosis state is when we're fasting for more than 12 to 24 hours, when food is scarce, and in that state, our body goes over into this ketosis state, and it does quite a lot of things to sort of shore up the defenses, to bunker down for hard times, because the evidence would really support, our thoughts that this is the body's response to no food rather than someone says don't eat any carbohydrates at all. And so I quite like that approach of actually looking at the science and how, when people lose weight, there are always health benefits, even if they do it with a pretty terrible diet. And that when the body goes in a bit of state of ketosis, in the short term, the body sort of ramping down some inflammation and other responses. So I think what comes out of this is we can talk to people doing low carb and, a short-term low carb, and yes, they're losing weight, but we can understand, how they might say, but when you do ketosis and this, and when you do this, and hey, when you stop eating all the processed junk, there's going to be some health benefits, isn't it? Even if you are, eating more meat. And so we can now talk to people and think about this, that, and actually acknowledge that just restricting food and calories, brings about some of these benefits. And but then we can also talk to people and inform them that, calorie for calorie, it's no better than any other restriction of calories for weight loss. And in fact, if you were to do low fat vegan, low calorie diet, you lose as much weight. And you'd get an even better, like one of the things that tends not to happen when people are eating a meat heavy, low carb, calorie restricted diet is their cholesterol doesn't do that great. Whereas usually when people are losing weight rapidly, their cholesterol will improve. And so we can talk to people and acknowledge that they may be experiencing health benefits, that people may have done research, picking on little reductionist bits and pieces to show things that improve. But then we can explain to them that they can actually do a healthy diet. They could do low fat, whole foods, plant based, and they could lose just as much weight. And their cholesterol would actually go down much better, and their blood sugar will also improve. Um, and then we can look and say the long-term evidence is not good for the meat-based low-carb approach. In that, at 1 year, most people have dropped off the diet. It's actually surprisingly hard to maintain. Um, and their weights usually drifted back to where it was. And some of the short-term, apparent and metabolic improvers from, the short-term weight loss and things are starting to actually swing the opposite way. And, just about every biological marker and system is sort of adversely affected, from their gut microbiome to the blood cholesterol levels, which some of them will dismiss cholesterol as not important because, it's an inconvenient truth. These diets are not good for that. And the TMAO, etc. So when you start to look at the long term, yeah, there have been studies, largely observational, like what happens to people who have been doing low carb, usually more meat based than plant based long term, and it's like increased mortality, that's death, increased death from many causes, and increased death rates overall, which is not good. Seeing that we've got a much better strategy for getting healthier and restoring our metabolic health and losing weight. So that's a nice little synopsis of the workshop, that day one session. It's very interesting to see all the science, and we wish that Australian low carbers, and I won't mention any of them, could see some of this data and understand better about, why they currently see improvements with the low carb meat based diet, and why it's actually a very bad idea, and why it has so many negative effects in the long term.
I think many of the participants in the room yesterday, we all feel the same frustration when we even have colleagues, healthcare, doctors, nurses, whoever, who believe that they're following the science, and that the following a low carb diet somehow is superior. And so it was quite echoed, wasn't it? This feeling of they feel like they're dismissed so easily whenever we talk about the benefits of a plant-based diet. We get it's easy to be shut down by, if you're in an organisation where everyone is following something different to you. So we really understand how hard it is. It's hard for those of us that are care professionals, and how hard it must be for all of the public who, and for those of you who are following us because you do believe in the benefits of a whole food plant-based diet. Diet we're made up of whole grains, legumes, fruits and vegetables, and some nuts and seeds. And how confusing it is when there's just so much out there.
The frustration is like, when we get to people to understand that we're actually closer to the truth, as far as
What the science
the science becomes, then those advocates who are spinning some story to them about, low blood sugars and why this is good and how they're losing weight, etc.
One thing that I found really good about Scott's presentation was, I remember when he was talking about at the cellular level, like looking at all the different levels and oodles, which eating a diet based around grains, beans, fruits and veg.
Well, and at the other,
It's healthy compared to.
and the other end of the dietary spectrum is, you know, we need 5 Earths to eat a carnivore diet, and like, who are you going? Which 4 out of 5 people are you going to starve to death so you can eat carnivore? Low carb's not quite as bad, but it's still pretty bad when it's meat based. And then, what are you doing to the Earth's environment? And when there are 8 billion of us, soon to be, 10 billion, like this is just not going to work. And just putting aside the whole issue of the horrendous condition of animals in modern um, animal agriculture.
Hmm. And anything else about the workshop?
No,
Just went through in the morning, and it's great. And then the main conference kicked off with Scott Stoll giving his sort of opening address. And at the start, they each year, for not since the beginning, but for quite a few years, they present a Luminary Award. And this year it went, actually wasn't posthumous. They actually, I understand, presented it to John Robbins. And but the
John Robbins had some post-polio syndrome that's quite common decades after polio, and so here is
just a few months ago he passed away.
yeah, and so he was given the award and gave a little thank you video that he'd recorded before he passed away a few months ago. So that was quite moving. And his son, Ocean Robbins, who very much follows the same path, received the award on his father's behalf.
Mm.
The first evening presentation was by Dr. Scott Small again, and he was talking about the play of the plate, just the play of what we put on our plates. And the first part of that presentation was, the power of the plate in terms of the destruction that the plate can cause, that your food choices are not just influencing you, they're influencing the environment, influencing other people, all the food waste of our current food system, the impact of some of the animal agriculture and other agricultural systems and things on the world. And then he moved that through to the benefits of, sharing food, of what's on your plate, and, how you can help heal your body, but sort of also help bring the world together. And the power of the plate in terms of, sharing it with your community, helping to bring people together, helping to restore people's health. And, you know, um, well, we're very central to human culture, and it's I thought not many other animals, do this sort of we share our food as humans. And yeah, he just showed the power of food sharing. And we're quite proud. I'm proud of Jenny and Peter Johnston in that they do such a good job of running a regular potluck in our city of Melbourne. And I encourage people in other cities who are listening to that, if you don't have a regular potluck potluck plant-based meetup group, to try and form one or encourage those around you.
Well, there are some active ones in Australia. So in Melbourne, we run a plant-powered Melbourne meetup about every 6 weeks, maybe 6 to 8 weeks. Often it's at a place where we can share food, each bring a dish. But occasionally we also find a restaurant somewhere in Melbourne where, and usually it's not me that does this work, there's someone else has big success in getting the restaurant to create a whole food plant-based meal, low in sodium, without oil or absolute minimum oil. And so that's Plant Powered Melbourne. And Plant Powered Adelaide meets every couple of months. So they're reasonably active. Brisbane have been doing fantastic stuff. In fact, I've just seen another event listing. I don't remember the date, but sometime this month, when they've got Anne and Jane Esselstyn going to be beaming in to their next meetup. So So that's Brisbane, Adelaide, Melbourne. That's had Sydney, but it's been a bit dormant for the past few years. But I do know a couple of people who are interested in getting it sort of restarted, and certainly I'm happy to provide every bit of support, from afar, to help this work. And there is Cloud Birth, and there has been just a couple of, I think, small picnic meetups over the past 6 months. So they're the active ones, and we encourage you to, if you know people in your community, to just get together, because it's the getting together, sharing food, and you just feel like, hey, I'm not crazy. I'm not the only one in my community who's doing this, because we know most of you. You might be the only member of your family who's trying to eat this way. And, as we started, we're talking about the, understanding why the rise of low carb and carnivore and keto diets. Many people are doing the exact opposite to what we're doing. So yeah, Scottsdole's very inspiring about creating communities.
It's it's far more than the food. When you create a community and you create connectedness to your to other people with shared interests.
And so the first full day of the conference, wow, there's been some good speakers. I'll just rattle them off and then we'll pick out a few things from some of them. Dr. Neil Barnard, Dr. Kim Williams, Dr. Dean Amish, and Dr. Vukovic. They've all given talks on the Saturday of the conference. So it was a pretty big day. A couple of speakers. So, and Dr. Michelle Loy talking about pulmonary medicine. So do you want to pick off some of your favourite or your highlights?
Well, not enough. He's an excellent speaker. He's an excellent presentation. And he's so personable, if that's relatable in his presentations. And, he started off talking about his menstrual pain study and, how much difference things like this can make to people's whole lives. It's not just, a medical condition or medical symptom. Um, and then I guess he moved on from that.
I'll just mention that he did specifically talk about people with endometriosis.
Someone went into the operating theatre and it was possible she was going to have a hysterectomy at an early age. And they went in and had another look and was on, oh, Veronica, looks like endometriosis has just gone away, settled down. And all we had to do was we cut all the scar tissue because there's a lot of scar tissue left behind. So that was interesting. And of course, he presented data about dairy. It's 2013 a conference, but I remember Neil Barnard saying something like, and a special word of condemnation for dairy, or was it cheese? Anyway, he did present some, data to sort of show this of increased risk of both breast cancer and prostate cancer with, increasing dairy intake in particular, and noted that, dairy upregulates growth. It's meant to do that for infant cow. But it also contains, pregnant dairy cow hormones as well. And incidentally, we also milk pregnant cows in Australia. We're not that much different in our food supply. So that was interesting. He talked about his hot flush menopause study and how the soy products sort of help to dampen down some of those low estrogen effects of passing through the menopause phase of life. And fixing that with the same soy isoflavones actually have a down-regulating effect on some of the, things you don't want stimulated by those hormones, like, things that might lead to breast cancer or uterine cancer.
Just want to something I've recently employed on podcasts about that particular menopause study. But something I didn't know was how it came to be with what was the number of grams of soybeans? To how they came to do that. So, well, he had a patient that had tried a whole food plant-based diet and added some soy, and had come back after a period of time. I forget how long. And said that her symptoms had completely gone away. And so he said, we want you down.
I haven't really experienced the results, demonstrating any
Right.
demonstrating any resolution of sort of, some of the quality of life menopausal symptoms.
So he found exactly what they did and how much they used. And so he said, pulled his research team together and said, let's do a study and we'll do exactly what this woman's done. So I think that's quite amazing.
It's matter. Like that it needed to be a plant-based diet. It needed to be a low-fat plant-based diet, and
Needed to have
needed to have
soybeans.
some soybeans in there. And we'll provide a bit more data later on about the isoflavone content of different soy products and what would have been equivalent to what's in the study. We have got a chart on our website at the moment, but we'll update that. So that was really interesting, and talked about prostate cancer and a 16-week study where they greatly improved blood glucose control. Another study where liver fat, people with fatty liver, which is a huge number of people, how quickly it settled down. It talked about the Mediterranean versus vegan study, for how much more effective he's always saying, encouraging people to be low fat because that's what he does in most of his studies. He's always saying keep the oils low, by which he's actually meaning that the study yes, in many of those studies he sort of limits the fat rich plant foods, and I guess that would include some of the nut products. And interesting, and Bernard wasn't the only one today to talk about ultra processed food, because as you would have all heard about ultra processed food and how it's bad for health and has emulsifiers and etc. And it's ultimately on that people in the meat, dairy, egg industries have probably sort of fomented, shifting the blame onto ultra processed food. But a lot of ultra processed food does deserve the flak it gets for being unhealthy. And it's interesting that, the animal-based ultra-processed food, the hot dogs over here and all the bacon and prosciuttos and salami and stuff in Australia, just how bad that very processed meat is for health. But when you actually look at, the data, there's some ultra-processed food like, if you have cornflakes and soy milk, for example, some of those cereals that would get classified as ultra-processed, are actually pretty good alternatives to things that are worse, like, eating eggs for breakfast or there's a sort of bit of a move there to re-examine the whole ultra-processed food issue and to be a bit more nuanced and to sort of go, well, these ultra-processed foods seem to really cause damage in the study, but there are some other foods that would get classified as ultra-processed, and health-wise, they don't look too bad.
So we should be
So
I introduced by saying that it was about the science of the science behind food, hormones, and health. And he's got an excellent book, Your Body in Balance, which if you haven't read that and you're interested in the science of hormones, food, hormones, and health, then I recommend reading that. We won't get it for too long to can we really
Stephen Williams, the cardiologist who's accidentally made himself famous in the vegan world by saying, I sometimes joke that, and he said that there are two types of cardiologists: those who are vegan and those who haven't
read the data?
read the data. Yeah, so he gave a very good talk. Any highlights from that one?
Um, The second part of this talk, if any of you watching were at, he comes to Melbourne every year for the tennis. This year he came to one of our projects, didn't he? He did a formal talk there with us.
It's nutritional too. Kim Williams take a few hours between the tennis sessions. He's a tennis tragic, and come and do a Q&A with our potluck.
Well, the year before, Doctors for Nutrition organised a dinner in Melbourne where he did talk, and he talked about the barriers to people, taking up when the data is so clear of the health benefits, for heart health and for so many other aspects of health. Why aren't more people doing this? So we did this sort of 18 months ago, and so that was incorporated in this. And it was, I think we built on a lot of this, but it's the first time.
First part, when you mentioned those of us who are interested in published research, who are science, healthcare, nerds, scholars, might be interested in the International Journal for Disease Reversal and Prevention, the IJDRP. You have a login, but it is free. And he recently published, he's actually published the why, if there's this much science supporting, whole foods plant-based for heart health, why isn't it, ask ChatGPT the question, and ChatGPT, sort of has a go at each of the different categories, but he talks about the different areas of that. But he talked about, what works for heart health. Like, does intermittent fasting work? Well, that loses a bit of weight, but maybe not a lot happens. And if it's plant-based, we get this changes and we get these results, and cholesterol plummets and blood pressure goes down and weight reduces and TMAO disappears, etc., etc. So that was interesting because he and talked about like some of the Pretty study, like, well, it was really a neurology diet rather than a cardiology diet, because yes, they had a reduction in stroke, but not much happened in the heart attacks or heart failures in the area. Well, they actually did a sub-analysis where they looked at the pro-vegetarian eating pattern in Pretty and there they did find there were big reductions in death rates with those who had a more vegetarian, more plant-based Mediterranean diet.
So just to take the context, I forgot to introduce, his talk was the cardiovascular impact of diet plans, what works and what hurts. So,
of course, the ones that hurt the most, the keto animal-based diets, and how they worsen cholesterol, and how the longer-term results, like 12 months plus out, are a lot worse than the short term. And, a mention of the carnivore diet. And then we looked at some of those, 2 or 3 COVID studies that showed that, it may not make us bulletproof, but it gives some protection, better outcomes when we get sick with COVID. I talked about some other diets and things, the ultra processed food.
Probably maybe go on to talk about Dr. Dean Ornish.
Yeah, I think so. Then we had to talk about Dr. Richard Rosen.
Because I'm sorry, I jumped out of order. Dr. Ornish was meant to talk later in the day, and he.
Yeah, there was a swapping around in the program. Yeah.
Anyway, he has presented before at this conference on his research into Alzheimer's. And if you haven't seen the publication from middle of last year, and I think we did a live stream talking about that. I'll put that in the
dementia studies.
And he just gave a little snippet of some of the follow-up after 5 years. I think he couldn't say too much because there's another publication in the pipeline. But he did present, I think, an abstract at some conference somewhere in the US. So,
for the dementia study.
mm, mm,
Um, yeah, they've done a 5-year follow-up
Yeah.
paper on that study. I mean, and we have seen the little videos before of some of the subjects in the dementia study.
Many people in Australia would have seen those videos. We saw them last
Right,
year at the
yeah.
conference.
Yeah, and there's a small study of lifestyle for dementia. Like we're going to hit them with a whole foods plant-based diet. We're going to deliver the food to them. We're going to do a 4-hour online session with fitness, activity and relaxation / meditation and group get together and a lecture. We're going to do this 2 or 3 times a week with these people. This is how they ended up doing this online program for the people with early Alzheimer's, diagnosed, tested early Alzheimer's. And there were plenty of supplements, and so it was like it wasn't just the whole foods plant-based. It was like I want to throw everything at all the lifestyle measures of these people that might help. And remarkable results because I think 3 out of 4 of the scales of, for measuring, cognitive impairment, um, actually stabilized or improved in nearly all of the people in the intervention, whole foods plant-based lifestyle group, whereas they tend to stay the same or got a lot worse in the group that did nothing but was going to do the program after the 20-week study had finished. The videos that he shows of some of the subjects, if you like to call them that, the people with early Alzheimer's, it was quite moving because you saw the human side of what it means when someone can't play their musical instrument in their band or can't do the home business, financial books because they're just a bit too confused and things, and how much meaning it adds back to their life and joy and takes away the, misery. I'm going down from Alzheimer's, there's nothing I can
There's
do,
no hope. Yeah.
and there's no hope. It actually gives hope. So you see improvement and they get purpose back. And that was really moving to see.
One of the videos actually showed a woman who was, when she was part of the study and how she'd already experienced a lot of improvement. But they came back. It was actually a video done by Sanjay Gupta for CNN, and I don't think it's available to watch in Australia. But 5 years down the track, this was someone with Alzheimer's more than 5 years ago who, halted its progression and actually reversed, many of the symptoms. And 5 years later, she's feeling fine and still living a useful life. So
Yeah, when no one's saying that, that they completely reversed it, but they did experience improvement. And this is an example of, halting the progression.
mm.
And so that was a very meaningful sort of result to that individual.
We've gone 33. I'm just thinking, we just briefly mentioned Dr. Andrew Freeman.
Ornish. So Ornish talked about, his early heart disease study, that showed that lifestyle could halt, not just halt, but reverse coronary artery blockages with heart disease and reduce the chance of having to have any events or anything done. And then his later study with prostate cancer, which also showed that it caused a lot of the diet lifestyle program for the prostate cancer study many years later showed that you actually bring about all these epigenetic changes. I mean, you lengthen the telomeres, which is sort of one of the aging indicators in cells, and you regulate a lot of genes that help cancer grow, oncogenes, and you sort of, even though you still got the same genes, they're expressed differently, like the ones that promote cancer not expressed as much, and some of the protective ones are upregulated. So this was, one of the probably first studies to show that you could regulate how your genes are expressed with, low-fat vegan diet and lifestyle. I want to like Ornish. He's always talking about, how we use state-of-the-art complex measures, but introduce simple lifestyle changes that brought about the changes. And he talks about lifestyle medicine, like eat well, move more, stress less, love more. The love more is sort of some of us find hard to relate to that. That's all about connection
And
between people and community
support.
and support. And doing these simple things it improves multiple biological mechanisms from from the expression of genes to oxidative stress to inflammation, and then this in turn helps to reverse diseases, whether it's down-regulating cancer growth or reversing heart disease or slowing or halting Alzheimer's disease. And this is part of his, unifying theory of lifestyle medicine. That a lot of our sort of chronic diseases, chronic conditions, caused by the same underlying sort of lifestyle behaviours through the same biological mechanisms, but then manifest as all different diseases. And I think this is what also means that if you give someone an Ornish diet for their Alzheimer's, you're also going to help suppress cancer growth and improve their heart health.
The Ornish diet is whole food, plant-based, quite low in fat. Final comments on any of
This topic.
Well, for the last few years, he gives a talk when it's the year in France, it's called. So he just showcases, there was some 75 slides of just research papers that have come out in the past year, which are, supportive of, the evidence supporting why we advocate and eat ourselves, a whole food plant-based diet. And so every time I hear him talk, it's like it's just so obvious. I just don't understand why so few people know about this. It's just so.
Yeah, of the years. Sort of like, oh, it looks like for heart disease or dementia or cancer, the local diet's better or the, whole grains are bad or something. That just doesn't happen. So sort of what we know just sort of gets reinforced and the more and more nuances get put into it about the complex details. We should mention Switch. Switch is actually giving a presentation at the Plant Nutrition Project puts on this conference. Our sister organisation in Australia is Doctors for Nutrition. Their weekend conference is in November in Adelaide, and they've got Dr. Bulsiewicz.
He won't be there in person,
No.
but he'll be giving a presentation.
Give a dedicated online recorded presentation for us, for Doctors for Nutrition in November. And yeah, today he talked, I'm not going to talk as much on this one, because we've talked too long. But today he was talking about, the role of inflammation in so many different conditions, excessive inflammation beyond what you need to fight an infection or heal a wound or something. And then talk about the microbiome, the gut microbiome and how that plays some role in so many different conditions. And then really sort of the link up between, the gut microbiome and obviously what food you eat that's going to drive that, but also some other lifestyle things will drive the gut microbiome as well. And how that relates to
I was asleep during when he mentioned sleep. Suffering from clouds.
Jenny, still in Melbourne's time zone. So inflammation, or the gut, you talk about the gut microbiome and how that relates to, the integrity of the gut barrier, the barrier that separates, the outside world, that's poo tube, from the inside world, which is, inside our body, and how, we've got the microbiome, and then there's hopefully good strong gut barrier, and then we've got a lot of the immune systems sitting just inside, and therefore inflammation, and so the strong connection between diet and lifestyle and the microbiome, and the inflammatory response. Yeah, so that was a good presentation. We might hear something similar in Adelaide in a couple of months' time.
Yeah. So there's a bit more of a conference to go. Because of our travel plans, we're not quite sure when. We'd love to be able to do another little video presentation of but we won't make any promises. If you follow us on YouTube, you might see an alert if we set it up as another event, or on Facebook. What other things coming up? We've got our next 4-part webinar series, which we pitch that at people who are interested in transitioning, or maybe have transitioned to eat a whole food plant-based diet, and they have so many questions and confused maybe about what's the healthiest way to eat, how to put this together. So we've got that starting on Sunday, the 28th of September. We run at 7:30 p.m. Melbourne time. People can join us from anywhere in Australia or in other parts of the world, as long as you can. We like you to join us live if you do the webinar series, but we do also provide the recording if you miss that. So if you don't attend them all, that's fine. But we like to, we know that when we've paid for webinars and we don't turn up live, you almost never get around to watching it. So that's why we kind of say, hey, we prefer it if you're going to do this webinar to join us live and you can ask us questions.
The other thing is, it's quite a small group, like it'll be less than a dozen people. Maybe there'll only be 6 or 8 people. It's you'd be surprised in a 4-part webinar series, with a bit of chat time at the beginning and question time at the end. How much group support can develop and come out of that.
And we've got an immersion in October. We're nearly full. There is one room remaining, which could be used by twin occupancy or single occupancy. Plus, there's availability in share room. So I say we're close to full. But if you are interested in our immersion, I'll give a link for when I'll do this. I'll try and write up some notes and put a link on the YouTube page for how you can find out more about our immersions and our webinar series.
The 10th to the 26th.
There's something else. I don't think it's been advertised yet, but you're involved in webinar developments for nutrition. We know the date and time, but we don't think it's been advertised yet. But when it is, we might put a link to that as well. It's 26th of September.
Yeah, I think that's right.
Yeah, it's on heart disease.
Yeah, it's on heart disease, and so we'll be talking about plant-based nutrition, a little bit on other lifestyle, and heart disease, and Nina Trinket, who's a fabulous dietitian in Melbourne. Nina will be talking a bit more about the food side of things.
Okay, I think we've talked for long enough, so we'll say farewell and until next time. See you later.
Goodbye.